Okay.
Good morning.
Well, good morning, everybody. It's 10 o'clock and it's Saturday and it's time for the Be Health Initiative. We're so excited that you're joining us today. I'm here with Dr. Maude and we have an awesome program planned for you today. It's all about your health. It's Be Health Initiative, and today is about oral health because your smile really does matter. So why don't you like and share, tell somebody. We have quite a few people that were already on already, which is great. So I see some of the members of the light. Hello, Miss Cheryl, knew you were going to be on there. Hello, Shantaria. Hello, Ebony. Hello, Miss Charlotta. Hello, Cynthia. Hello, Sheila. Hello, Jennifer. And hello, Vera. So everybody make sure you like and share. And Dr. Maude, I'm going to give it to you to just welcome everybody and kind of give an overview of what's going to happen today.
Well, good morning, Pastor Bridget, and thank you so much for allowing us to come out into the community and talk today on oral health. We are welcome to the Passport to Stimulating Healthy Lifestyles. Welcome to the Facebook group. Welcome to the YouTube group. Welcome to all of the Bees, Girls, and Sassy Ladies. We are the Missouri City chapter of Links Incorporated. We are one of 8 chapters here in Houston of the international not-for-profit corporation of Links Incorporated. We are professional women of color that are dedicated to the empowerment, the education, the enlightenment, and the health of our community. This is our Health and Human Services Facet program, and we're partnering with Dr. Bridget Hilliard and the Bees Girls Foundation. We are working on diseases that plague our community and actually cause a lowering in cause problems with health and can be prevented. We're working with mothers, with grandmothers, with daughters, with our families, so that we can see the things that we can do to get our health better. Certainly, we've seen with COVID-19 that hypertension, diabetes, heart disease, cancer, stroke, many of these diseases, obesity, increase our risk of COVID-19. It is those comorbidities, which is what they're called, that cause us to have this increased risk. And certainly it is these comorbidities that can be prevented. So we're learning about those. Certainly during the pandemic, we've all had someone that's been affected. And certainly many of us have lost persons in our families or people that we've known as well. So we want to be able to make a difference in our community. Certainly there's someone that you know that you can pass this information on to, and we want you to invite them to use the YouTube, to use Facebook, to get more people involved, because we can make the difference for our own families and make a change. You each received a list of questions on oral health. By the time we finish this program, you will be able to answer all of those questions. Certainly, we want to be able to pass that information on. We're anticipating that you'll learn something about oral health. We have 3 speakers today, and they're fantastic. We're going to start with Dr. Simone Ellis. She's a cosmetic and family dentist and the owner of the Smile Design Studio, located in Missouri City, Texas. She is the founder of the Houston Minority Dental Society and the director of the Smile Design Studio Academy, which is a mentorship program for high school students and for college individuals that are interested in going into dentistry. Dr. Ellis enjoys educating and giving back to the community, and that's why she's here with us today. She's going to talk to us about the fear that people have of going to the dentist during COVID-19. We know that everything in your doctor's office has changed, and certainly at the dentist it's changed as well. So she's going to talk to us about what we can expect and certainly how to keep ourselves safe at the dentist's office. Dr. Ellis, thank you so much for joining us and giving of your time here in the community.
Thank
Good
you so much.
morning. How are you?
Good morning. How are you guys doing?
Good morning, Dr. Ellis.
Thank you so much.
Thank you. And it's been a pleasure to be a part of this. I think this is fantastic. I love what you guys are doing. And let's get this show on the road. Let's educate people and empower them about what's going on with COVID and dentistry.
We're ready.
guys, if you have any questions during this time, please make sure you put them in the chat so I can try to make sure I follow up with them. I'm here for question and answer, so I want to make sure that we are on track and making sure that you guys are feeling comfortable about going to the dental office. So that being said, let's go ahead and get into the slides and talk a little bit about COVID and dentistry. All right. So are they going to go ahead and put this? Yes, perfect. Thank you. All right. So thank you for doing the introduction. Of course, my name is Dr. Simone Ellis. I'm located in Missouri City, Texas. And dentistry has changed significantly within the last year due to what's been going on with COVID. Of course, dentistry always follows the guidelines in the dental offices of being a sterile environment. We want to make sure that everybody is safe and protected, and we have airborne pathogens, things that we already deal with on a day-to-day basis, that we are already protecting. But if you are a person that is a patient that is coming to the dental office, you may not be aware of what we do to make sure that the office stays safe. So today our goal is to go over protection and prevention, and also, as Dr. Mott was talking about, I want to touch a little bit on some of these pre-existing conditions that we're seeing links to how COVID can be impacted in the body if we have some pre-existing conditions. So let's go ahead and go to the next slide. All right, again, that's a little bit bio on me. We already talked about that. We'll go over to the next one. So let's talk about, my goal today is to make sure that when we finish our conversation, we leave with understanding the COVID impact in the dental office. We understand its oral health and how it relates to COVID, and then proper precautions and prevention for us to be able to have healthy smiles and be healthier. All right. So how has COVID impacted the dental office? Things are changing. Texas is a little different now because things are opening back up to 100%. But when COVID started in the year of 2020, I know it's like such a blur, right? That whole year came by and we're like, what happened last year? Well, things that were a little different in the dental office when we got to come back to some form of normalcy was, of course, we updated what we call a PPE, or the personal protective equipment. What that is that we all wear masks anyways when we're in the dental office, but now we've updated it to using more of a more intense mask, like N95. And the purpose for that is not only for us to be able to protect the patient, us from the patient, but also for the patients to be protected from the doctor. We are, of course, having aerosols in the air, and we want to make sure that there's no transfer of that bacteria back and forth. So we want to make sure that we're wearing those type of masks. Also, gowns became even more on the scene. Usually, this is, I wore this just to make sure I can show people. We usually use like some form of like lab coat or jacket, but now in the office, you'll see a lot more doctors wearing gowns as well, to try to make sure that any splatter that's coming on, they're changing them throughout the patients. Usually you'll see doctors using this during surgery or procedures that are going to be a little bit more intense, maybe a perio or deep cleaning where there may be a lot more splatter. We want to make sure we're protected. There is this amazing young lady who created, a 15-year-old who created these awesome gowns where you can reuse them again by just spraying on like Lysol or disinfectant on them and wiping them down, which has been really great. So I always try to make sure that also the footprint that we're leaving in the world is not, a lot of waste. This gown is I like because it's reusable and you're able to keep them clean and make sure you're protecting them in between patients. So you want to make sure that whatever dental office that you're going to, that they've updated and made sure that their PPE is, within a great standard of care to keep everybody protected. The next thing is patient precautions. So you probably, if you have been to the dentist during this time, most places are taking temperature to make sure that we are protecting that virus before it's coming into the door, to try to keep that down. Now, I will say this. you can still have COVID and not be running a temperature, as we know. So it's just one more precautionary step to try to eliminate the exposure risk. Another thing that we were seeing a lot more of is that patients rinsing out before they come into the office with either Listerine or hydrogen peroxide. The thought process behind that is just to see that it helps to kill any viruses that maybe are extra bacteria that may be going on before we start that process again. There's not truly so many studies that say that that really does eliminate COVID, but the idea behind it is just saying, hey, if we can rinse out our mouth and kill any active bacteria or viruses that may be going on, it will be another layer of protection. And the last thing that we've been seeing an impact in the dental office is moving more virtual, right? The whole world is turned more virtual. So as far as consent forms, paperwork being sent to you prior to your appointment before coming in, doctors have made a really big shift to make sure we're more computer savvy with our patients because of the fact that we want to eliminate the touching of paper. We want to eliminate patients having to wait longer than they need to be in the waiting rooms before they can come into the patient office. So hopefully your dental offices have been incorporating some of these things to help make our exposure to this risk a lot more minimal. Next slide. All right, so let's talk about oral health and COVID. So dental health is really something that's really important, and I think that I call it almost like a silent killer, because a lot of times people won't come to the dentist unless they're having some form of pain. But routine care is so critical, because as you can see, 3.58 billion people are affected by oral disease in the world, and a cavity is considered an oral disease. Periodontal disease, gingivitis, these are all things that are related to the oral cavity. And so this is a huge number, and I want you guys to remember this number, because when we go to the next slide, we're going to keep seeing why this number is so important, right? So 3.58 billion people, and 27.9% the kids have it from 2 to 5 with tooth decay, and then 51% of people have some form of 5 and 11 have tooth decay. These are just children. So when we go into the adults, we're seeing about 78% of people have some form of dental decay in their mouth, right? So we got 3.58 billion people that have some form of oral disease, and a portion of that is cavities. Another portion of that is periodontal disease. For the lay people, periodontal disease is when we have gingivitis, which is the inflammation of the gums, has gotten so bad that now it's impacting the bone. So why is this important? Well, periodontitis, which again, which we just talked about, which is the serious gum infection that has now had some destructive form on the bone, that is something that is irreversible. Gingivitis is reversible. So if you guys see bleeding of the gums, your tissue is irritated, you're not going to feel it. That's why I call it the silent killer. And I like to use this example when I talk to my patients. If you were to brush your hair and your scalp was to start bleeding, you would automatically want to go to the doctor. You'd be like, something is going on, but we don't think about that when it comes to our gums and our teeth, right? So, oh, I feel like something is bothering me a little bit, but I'll let it go. So we've got to get out of that. And periodontitis, you're not going to feel that. You may not even smell it. The dentist will smell the destruction and the decaying process of the bone, but most people really don't get an opportunity to really feel it until it gets worse. So if you start to notice some bleeding, just like if you would see it on your scalp and your hair, you would want to go and contact your doctor, right? So with periodontitis, we see that there is some links that are between periodontitis and respiratory problems. Now you guys can kind of see why the 3.58 billion is starting to have a bigger impact, right? Because as we know, COVID attacks what? The respiratory areas. So if we're having a link to now periodontitis and to having respiratory problems, of course, what is that going to do? It's going to increase our risk for complications, and that puts us at a higher risk for more hospitalized patients. Well, if we already have a down respiratory system going on, that puts us even higher susceptible to COVID. So that's why periodontitis, getting that under control, is so critical to helping us make sure that we're putting ourselves at not a high risk for COVID. And let's talk about the bacterial infection. So again, when you have some form of disease going on in your mouth, of course, right, that is putting a very, very big stress on your body. So your body is like, okay, hey, I'm trying to fight what's going on in the mouth, and now I'm trying to fight what's going on somewhere else. We're putting all of our energy and effort somewhere it doesn't need to be, which now will make it harder for us to be able to fight something that it really needs to fight, which is like a COVID, right? So if I had to choose between my body fighting about periodontal disease or COVID, I'm going to want it to go after COVID all days, because I can fix periodontal disease. That's easy. I just need to go to the dentist to get that taken care of. So how do we prevent that, right? Routine checkups are so important. A lot of times I'll hear patients say, well, I only go once a year. Well, I understand the thought process of getting a wellness scan once a year, but the mouth is exposed to things every single day. If you're only eating one time a day, that's 365 times a day that you are, 365 times a year that you're having something going in your mouth, right? And if that's not being cleaned up on, at least every 6 months, if you're a routine patient, or every 3 months, if you had some form of periodontal disease in the past, we're really putting ourselves at a disadvantage. So the other thing is completing dental work, right? Again, cavities, decay, a rotting process that's going on your body. You're asking your body to do a lot of work in the mouth that's unnecessary. We can go to the next slide. So again, back onto what we just said, routine cleanings help us so much. Routine checkups help us so much, because it's going to decrease that bacterial load and that burden that puts on our body to focus on other things. And again, if we're seeing a correlation between periodontal disease and respiratory issues, I mean, people with COPD, asthma, any issues that are going to go with our respiratory system, which we know COVID is attacking, we're putting ourselves at a disadvantage. So standard precautions in the dental office, making sure that we're following the guidelines to have a great sterilization center. In my office, we make sure that even on our tour, we're letting our patients know we're with OSHA. We want to make sure that our patients see how we're cleaning our instruments, how we're keeping everything sterilized, because that's so important to try to kill any type of infections or bacteria that may be transmitted to another patient. And the dental office had already been doing that, right? So the scare is that, okay, can I go to the dentist because during COVID? Yes, we were already probably following those guidelines anyways, and you want to make sure that you're not taking your health and not by going for a year or 2 years because you're nervous. The dental office is a safe place. Also, we just talked about that mouthwash. They are really trying to work on some more different products that'll kill even more things. But for right now, your typical Listerine is doing a good job with just killing bacteria. And that helps us, again, decrease that bacterial load. Aerosol systems. This is something that's newer, where people are putting these infiltration systems into the airways so that we're trying to eliminate as many things that are coming out in the dental office to help us lower our risk for exposure to anything that's harmful. And then, of course, cleaning surfaces. I know all the dentists, including myself, were frustrated when COVID happened because everybody was buying up all the disinfectant that we absolutely need. Of course, increasing the cost for us as dentists, but we want to make sure that you guys understand that we're cleaning hard surfaces, which is what helps eliminate any type of bacteria transmission. We're doing our part to wipe down things, making sure the dental offices are super, super clean so that we're not transferring anything into patients. And the next slide. All right, so guys, that pretty much wraps up my portion of it. I hope that I've made you feel more comfortable about what's going on in the dental office, why it's so critical and important for you to make sure that you're taking care of your mouth so that you're able to keep yourself at lower risk for getting COVID, as well as making sure that you know that routine care is so important. It has been an absolute pleasure to have this conversation with you guys. If you have any questions or concerns, this is my contact information. This is where I'm located. Feel free to reach out about any questions that may arise, even about your dental health. Thank you so much.
Thank you, Dr. Ellis. That was amazing.
Thank you.
I'm Monica Continental Poindexter, and I have the pleasure of introducing our next speaker, Dr. Portia James. She's an oral surgeon, a U.S. Air Force veteran, a graduate of Meharry Medical College, and she's also the owner of About Face Oral and Facial Surgery. Good morning, Dr. James.
Hi, good morning, everyone. Thank you so much for having me. I hope that you guys can see me okay and without any issues. So I'm just going to talk to you guys today about oral cancers or oropharyngeal cancers. So in fact, this is next month is Oral Cancer Month. And so thank you so much for having me here. So quick thing about oral cancer, there's about 54,000 Americans that will be diagnosed with oral or oropharyngeal cancer this year. So it basically causes almost 10,000 deaths, which killing roughly one person per hour, and that's over 24 hours per day. So, of those 54,000 newly diagnosed individuals, only slightly more than half will be alive in 5 years. So, that's approximately 57%. So that's a number that hasn't really significantly improved, over the decades. And honestly, the reason why the number it used to be 50%, but the reason why the number has increased is because of what's called HPV, which is a human papilloma virus. So if you've ever heard of it, you probably hear a lot about that in like the OBGYN world when they're talking about the cervix or HPV as far as sexually transmitted diseases. So that is also a reason why, that number has increased. So, like I said, there's a 5-year survival of these cancers, about 57% or so. But the thing about oral cancer is that the mortality from it is nearly twice as high in some minorities, like Black males, for example, as it is in whites. So we got to prevent high-risk behaviors like cigarettes, cigar or pipe smoking, the use of smokeless tobacco, excess alcohol use. Those are things that are very high on the list of things that can particularly cause or prevent oral cancer by not using those things. So early detection is always key, in increasing the survival rate of these things. As I mentioned before, oral HPV or human papillomavirus, that's a very common sexually transmitted disease that can cause the cancers, like in the back of the throat, which is what we call oropharyngeal cancers. So it's a lot of things that are risk factors for these particular cancers. Another increased risk, we're going to talk about some risk factors. If you're older than 55, like I stated before, if you chew or smoke tobacco, if you drink alcohol in excess, or actually if you're even exposed to sunlight for long periods of time, particularly workers that tend to have outside workers, like where they might be landscape, doing those types of fields where they're outside all day. So when that sun is hitting their body, it's changing a lot of different things. HPV, as we talked before, or even people that have like a immune system that might be weakened by certain medications. Like some people are born with or have different autoimmune disease, or people have a disease that's called lichen planus, or any kind of graft versus host diseases. Things like that. So when we talk about symptoms of it, the thing that you don't want to do is you don't want to wait for any symptoms to appear. You want to always get screened according to guidelines. If you notice any of these symptoms that I'm going to talk about, you need to talk to your healthcare professional. So if you have any type of white or red patches on your gum, your lips, your tongue, or any of the inside lining of the mouth, those are things that are not normal. If you have a lump that can be felt on the inside of your mouth or neck, any kind of pain or difficulty chewing, swallowing, speaking, hoarseness that lasts a long time. I remember I had one lady that had hoarseness for several years, and considering that she was a smoker, like I said, those are risk factors that we need to think about. Also things such as like numbness or pain in the area of the mouth that just doesn't go away. Swelling of the jaw, loosening of teeth, difficulty wearing dentures because your mouth is currently is just constantly kind of changing. It just doesn't fit right, or it's constantly rubbing an area that has caused some type of growth. As Dr. Simone Ellis stated before, any kind of bleeding of the gums, sores on the lips that won't go away, or an earache that won't go away. So when we talk about oral cancers, we kind of board on that ENT. So the ears, nose, and throat, all of those things are connected. And those are things that you really need to be looking for when doing exams, or when those are things that we look for when we're examining our patients. Things that can prevent oral cancers or oropharyngeal cancers. Of course, we talked about tobacco. If you're a smoker or if you're doing smokeless tobacco, definitely quit. Limit your alcohol use to, no more than 1 drink per day if you're a woman, or 2 drinks per day if you're a man. Stay out of sun, especially like between the hours where it's a lot of daylight or where this sunlight is the strongest. And always use a lip balm, with the SPF 30 or higher. Even though we're melanated people, we still need to use our SPF. So, and then of course your diet is always a concern. Nowadays we don't know what we're eating. A lot of foods that we're eating are processed. We're in this fast food era where we're going to stop by McDonald's or Burger King or whatever. And so we're just going to eat, a lot of processed foods, or a lot of foods that have a lot of hormones in them that we just don't know how they're being processed or manufactured. So you want to definitely try to improve your diet. Eat lots of fruits and vegetables. So when you come to your dental provider, specifically when you see me, or you might be referred to me for an oral cancer screening or something like that, what has to happen is, typically when I see you, I'm going to be looking at everything. I'm going to do a head and neck exam on you. What that means is I might have you open and close, kind of check your, what we call your TMJ, your joints that help you open and close. I'm going to look inside your mouth. I'm going to look outside of your mouth. So I'm going to check your glands. I'm going to check basically from head and neck to see if I feel any kind of lumps or bumps that shouldn't be there, and have you swallow. Ask you if you have any pain when you're swallowing or anything like that. Of course, I'm going to look inside of your mouth. We're not just going to look at teeth, but we're going to look at everything. So, and these are things that you should be doing at home as well. So I'm going to, look under your lips. I'm going to check your lips for any kind of nodules or lumps or bumps or things that shouldn't be there. I'm going to be looking for any white lesions or red lesions that are possibly on your gums, or, like on the inside of your mouth, on your tonsils, or in the back of your throat, where that little dangly thing's back there, your uvula. I'm going to be looking at all of those things to see if there's anything that's abnormal, or if there's anything that look pasty or plaque-like. Those are things that I'm going to assess when I look at you. Another thing your doctor might look at, or they might pull out, are different kind of devices that can check to see. We're going to shine a little device, on different areas of your mouth. And what can happen is that this little device that we have, an example of, is called a viloscope. It's going to highlight different areas, and it might change colors, or it might highlight a certain color to let me know that, okay, that's not normal there. So if there's anything that does not look normal, or that we are suspicious about, sometimes what we might do is sometimes we might get additional images. First of all, we might do like a CT scan or MRI or something like that if needed. But when you come to see me, I also might do what's called a biopsy. And basically what a biopsy is I might kind of numb that area, and I'm going to take a sample of that area that looks suspicious. And so based on that sample of the little tissue that we get, we're going to send it to the oral pathologist. And what the oral pathologist does is they're going to look at it under a microscope, and they're going to say, okay, hey, this is cancer, or this is not cancer, or this is a precancerous lesion that might be happening. So depending on what that pathologist says, then sometimes it might be nothing. And then we're like, okay, great. Your specimen was reviewed. The results were normal. We don't have to do anything. We'll just see you, you can see your dentist at this point, every year for an evaluation or for a follow-up, just to make sure that nothing else changes. Everything looks good. Let's say, for example, if the pathology results come back abnormal, or, they might give us a definitive diagnosis, then particularly what might happen is we're going to talk to you about your results. especially if it's a cancerous type thing. We might ask you to come with someone before we discuss your results to you, so that you can have some type of support that's there. But after that, we're going to come up with a plan on what needs to be done. So typically, like I said, we might have to do some additional x-rays or kind of, CT scans or PET scans, MRIs, things like that. So we can see, okay, this is just localized to this one area, or this sample this area of cancer may have what's called metastasized, meaning that, it has spread to other areas of the body, which is what we don't want, but we need to basically assess those areas. So based on what's going on with the type of cancer that you have, it's usually a team approach that we typically have to do. So we might get on board with, hematology, oncology. We might get on board with ENT and plastics, depending on what's going on, or even general surgery, depending on how far your cancer has advanced or metastasized. So based on, what those findings are, that will be how we stage it. A lot of times cancer might be stage 1 through stage 4, meaning the worst. And depending on what the location is, some people might need chemotherapy, and they might have to get chemotherapy and radiation in conjunction with it before we even do surgery. Or sometimes some people might only need surgery. We might just need to cut it out, and that's it, and just watch it from there. So it's based on what the findings are and what needs to be done based on that particular cancer and how it has progressed, basically.
Thank you, Dr. James, for sharing all of your knowledge. We're so grateful, and we're excited that we get to hear more during the Q&A session in just a moment. So I have the great pleasure of introducing our next speaker, Miss Candice Easley. She is the owner and CEO of Tresor Cachet Boutique. Anyone who has an opportunity to see the fabulous items in her boutique also has an opportunity to interface with her and learn more about what a blessing she is to people. So you're in a good position to hear more from Ms. Easley. Thank you for joining us.
No problem. Thank you. I am so elated to be here today. Thank you guys so much for having me. My name, as she said, is Candace Easley. I am the owner of Tresor Cachet Boutique. I am one of the 50%. I am one, or actually at this point is now over 50%. I am one of the survivors. At the age of just literally, I was just having my 35th birthday. I had my 35th birthday that November, and I was diagnosed with oral cancer that January. And when I tell you to hear those words initially is a very scary thing. Especially with the type of cancer that I was diagnosed with, which is a very rare form. If you heard Dr. James earlier, she talked about males, she talked about over 50, she talked about heavy smokers, heavy drinkers. She listed literally a lot of things that, as you can see, I am not. So I am one of the rare ones that was diagnosed without having a lot of the commonalities that typically are found in the type of cancer that I had. I was diagnosed with the rare form adenoid cystic carcinoma, which is affected in your salivary glands. And I distinctively remember going to the dentist. I had some impacted wisdom teeth, and I knew I needed to get them out. They weren't really bothering me. To both of the doctor's points earlier, with our teeth, we tend to be a little bit more relaxed. I have time. It's my teeth. Nothing hurts. Nothing smells. I got a pretty good smile, right? So, hey, I'm good. I'll go. I'll make time. But I am here today to tell you, it's not make time. You have to you can't just say, I'm going to go. You have to make time for your oral health. Your oral health is just as important as your regular medical health, because my oral health almost took me out. I literally almost died. When I was diagnosed at stage 2B, almost stage 3. And if you heard Dr. James talking earlier, it's stage 1 to stage 4. And I was hitting the cusp toward this end of the number line. I had wisdom teeth pulled. I had a very small lump on the roof of my hard palate. And when you say, hey, Candace, what's your hard palate? Just take 30 seconds with me and close your eyes. Close your eyes and take your tongue. Put your tongue to the front of your two front teeth. Run your tongue all the way back from those front teeth, all the way as far as you can do it on the roof of your mouth. Everything that you just felt, I no longer have. I don't have a hard palate. I don't have a soft palate. I am missing molars. I'm missing pieces of my nasal cavity. And then I have pieces here in the jaw, to where she was talking about with the TMJ from the radiation that have worn down. But God is good, and I am here. I found a very small bump on my hard palate. And when I was having my wisdom teeth, which were impacted, removed, they took the sample, the biopsy that she was talking about earlier. They sent it off to MD Anderson. I'm at work. I'm doing my thing. This time, at this particular time, I was working corporate for GE, and I had the boutique that I had just started as well. So I was doing 2 jobs, just doing all kinds of things, for church, things for my nonprofit Icon that I'm a part of, and then essentially working 2 jobs, a full-time corporate job, and also trying to get this boutique thing off the ground. So I have the wisdom teeth pulled. They do this little biopsy on my hard palate, and they say, hey, we need you to come back. Even the oral surgeon, when he looked at it, he said, it looks a little bit, I think it may be okay. We'll see. We need to send it off. So they sent it off, and they give me a call. I'm getting ready to head to a meeting, and they say, hey, we need you to come back, and we need you to come back like today. I have a meeting to go to. I'm busy, back to not making the time. And they're like, no, we need you to come now. And it was something about the now in that voice, and the fact that they had also tried, like, hey, you're next of kin, your mother, like, what? We need you to come now. So I had this quickie, and I'm like, oh God, this sounds like serious. So let me go tell my boss. I tell him I'm not coming to this meeting. It's something happening. They want me to come back to the dentist. I don't know what the big deal is. So I go back. And when I heard those words roll off of his tongue, instantaneously a level, of fear like comes over you, like, cancer, what? Huh? In my mouth? How? I don't smoke. I'm trying to understand like how this has happened. And he's like, it's very rare. It's a rare form that you've been diagnosed with. So then I'm also thinking, is how rare is it? Because are you going to know what to do? Like, what's happening here? And I go, and he's like, you're going to go, you're going tomorrow. And I said, tomorrow? He's like, yes. He says the oral cancer is aggressive, and you can't take time. You can't figure out what you've got to go tomorrow. So I'm headed for MRIs. I'm doing CAT scans. I'm doing all of these tests that Dr. James just spoke about. And then I have a meeting with the oral surgeon. He says, okay, we have to do surgery, because although to your naked eye, all you saw was this little bump that's barely the size of an eraser on the number 2 pencil, this thing has started growing. And to her point, initially, I know I had saw that little bump in the roof of my mouth for weeks, and I'm gonna make time whenever I get time to do it. And who's to say that initially when I saw it, maybe I was stage 1 and not almost stage 3. But for me, putting it off, not taking the time, and I said, okay, God, we got to fight this thing. Like, I have a son, I'm a mom, I'm a wife, I have a business, like I have a job, like I can't be put down. And so he's like, no worries, we're going to go, we have to do surgery. And I said, okay, so what does that mean? What does that mean now for my quality of life? Like, you're telling me you're going to cut out the whole top of my mouth. So how am I going to eat? How am I going to drink? How am I going to do all these things? And he's like, well, we don't know till we know. So you have to have this surgery. So I go in, I have this surgery. I say, well, let's talk about the best possible things that can come out of this and the worst. And he says, well, the best is we get you a fancy prosthetic, and you learn how to talk and eat and do all this again, and you're fine. You could wake up, you could be trached, you could, we don't know how far until we get in of what all we have to remove. I don't know if I have to remove the hard palate and 2 teeth, or if I have to move the hard palate and all your teeth. I don't know if we have to We don't know. We don't know. We gotta check your jaw and all of this other things. You don't know. So I prayed and we went in, and I went into surgery. And hours later, I woke up and I started immediately going to my neck, because I remember saying, "Oh my God, I don't want to have to trach. How am I going to talk? I don't want this hole in my throat." And I looked, and I felt, he's like, "No trach, but you can't talk." So here we are going down this journey of fighting this disease. And I tell you, God is amazing. And God is so good. I still get chills just even talking to you guys right now. It's like, am I ever going to not be a crybaby about this? But I guess God is like, no, because this thing is real and it happened. So I had to have 4 surgeries, guys. 2 months of chemo, 2 months of radiation. My first surgery, I was 152 pounds when I went in for the first surgery. By the end of treatment, in a feeding tube later, I was 89 pounds. I was a healthy 6'8", sometimes a 10 if I was really, really eating good. But I was a healthy 6'8". I know people who see me now are like, how? I went from a healthy 6'8" to a 00, not 10, but a 00. So the transformation on my body from in the matter of less than 6 months was amazing. Like I look at pictures back when I rang that bell, and I was like, oh my God, I look like I'm 10. I was so small. I was literally the color black from here to here, from radiation, the burns. I couldn't talk. I couldn't eat. I was writing on a whiteboard and I had to turn it around. So then I got this fancy thing called the obturator, which now I have to, it's my new way of life. If I don't put in my obturator, you guys wouldn't be able to understand what I was saying because my mouth is hollow at the top. But my obturator allows me to eat, it allows me to drink, and it allows me to speak. But without it, I can't do any of those things. So I am here today to tell you that take the time and make the time. When I was in the oral surgeon office, he looked at me and he said, with a tumor this size, I cannot believe that you are not tired. And I looked at him and I looked at my mom who was sitting in the chair, and I said, oh my God. She and I both just got teary-eyed because literally the week before, my mom was at my house and I told my mom, I said, I'm so tired. Like my body is so tired. But if you remember when I said earlier, at that particular time in my life, I was on the board of a nonprofit. I was working a corporate job. I was starting a new business. I was a mom. I was a wife. I was doing 120 things at one time, running, going, and never slowing down. And I just felt like that I was super tired because, hey, I'm a lady that wear 50 hats. So tired is nothing. We're always tired. That is not normal. We cannot normalize the behavior of running our bodies into the ground that we cannot even listen. I was normalizing the fact that I go. And I'm just tired because I go. And not knowing that I was having a higher level of tiredness because the tumor was eating away at my body and eating my energy and silently traveling through. To Dr. James's point earlier, you really don't know how far along you are until you do a deep dive in to have an MRI. And even with the surgery, they may see that, oh, wait, hold on, it looks like it's one thing, but it's something else. So I'm here to tell you guys, take the time.
Awesome. Thank you so much. That was amazing. Dr. Mott, this has been one of the best informative, I think, Be Health initiatives that we've had with the Sassy Ladies. I really enjoyed all of them. And so we're going to answer some questions now.
Thank you.
So we'll bring everybody on, Deslin, and we'll start answering questions. We do have a couple of questions already in the private chat, but just so that everybody can see them and hear them, I'll just start saying them out loud, and then
Dr.
whoever
B,
wants
could I
to
just take a
answer.
moment to thank them? Okay,
Oh,
each one of
absolutely.
them, particularly Miss Easley for what she shared. Okay,
You're
many
Yes.
welcome.
times when we go through things like this, we don't come up and give that information to others. And I really want to thank her for giving this information and publicly acknowledging the things that she's been through. I want to thank Dr. James for her patience, okay,
Yes.
with our time this morning. You know, all of this technology is fantastic, and Dr. B is providing it for us, and we really appreciate each and every one of you. Thank you for giving your time and certainly all of your concern to the community. Okay.
You're so welcome.
And also Dr. Ellis, I don't see her
Dr.
on the
Ellis,
screen,
where is she?
but she was fantastic
She
as
was.
well. And I wanted to just say thanks to everybody also. And I just love seeing all of you all. The professionalism is just amazing. And of course, I know Candace personally, and every time I hear her story, I get teary-eyed. I had to put my head down to make sure I wasn't on the camera when she was talking. But just such an awesome testimony of the faithfulness of God. And of course, using medical science to help get you back to total health and wholeness. So so appreciate all of you all. And so everybody on here has a beautiful smile. So so we're gonna get into some of the questions as we try to figure out where Dr. Simone is. Yeah, so she's not on, but Candace,
she was going to be back certainly, and she's planning to be with us. She'll get her camera turned back on.
Okay.
All right.
Candace, several people ask, how long have you been cancer-free?
I am going on year number 6.
Oh, that's wonderful.
Fantastic.
Awesome. Congratulations.
Thank you so much. Yes, God is so good. He's so amazing. I told God, I said, God, if you allow me, one night I was in Cypher Medical. I was too far to get to Anderson. I had developed bronchitis and started getting onset of pneumonia. And they were like, we don't know what to do. And that's the night I said, God, if you let me wake up in the morning, I was in so much pain, they'd given me morphine. And I said, if you let me wake up, I promise you that I will give you this voice and I will use it to tell everybody that you healed me. You healed me. It was by your power, only by your power that I'm here. Only 50%. We heard Dr. James, it's over 50%. People don't make it. And I made it. And I say, God, if you let me make it, they're gonna have to shut me up. They're gonna have to shut me up.
I love it. I love it. Well, we love it. And there was another person on here said that they had the same type of a different type of oral cancer, but they're a 13-year survivor. So praise God for them. Amen. Yes. So here's one question. I am missing one back to and trying to decide on implants or just plastic denture or just a plastic denture. I'm in my 60s. What should I consider before I make my decision?
Well, I would say, lifestyle, or I can just contribute to if it were me. If I lost a tooth, I would want an implant because that's something that doesn't come out. A denture, you have to take it, put it on your nightstand at night. So it depends on your lifestyle that you want to have. Of course, the more economical will be the denture. But if you're able to afford an implant is always the way to go.
Great. Okay. The next question is from a parent. She wants to know how much milk should her children be drinking because she says she's starting to see a little bit of deterioration with their teeth. They're older. I think they're almost 7, and they drink a lot of juices, but not a lot of milk.
That's the problem, the juice. So typically, when, especially for adults as well, ideally, we don't want you to be sipping on juices and things like that throughout the day. If you're going to be, if you're a sipper or if you're a snacker, you need to be sipping on water or snacking on fruits and vegetables, because the sugar, it just sits on your teeth all day. And of course, that's turning into acid. And that's what's going to cause that decay. And a lot of times, especially for what we call baby bottle caries, like a lot of people, they like to give them that bottle at night. And those front teeth, they get all decayed because that that milk turns
Sits
into
on the teeth.
sugar
Yeah.
on their teeth, and it sits all night. So yeah, your dentist is not gonna like that. I don't do cavities or fillings or anything, but if Dr. Ellis would be like, no, that's a big no-no.
Well, I think she says she can talk, but she can't. We can't see her face because she's having some trouble with her camera. So, Dr. Ellis, if you want to elaborate on that a little bit more. I don't know. I don't see her.
Aw.
I don't see
So basically, your advice would be when they get up a certain age that they should be drinking water, more
Yes.
water. Okay.
Yes, definitely, for sure. They need to be, unless they're having an actual meal at that time, you know, they can drink a little bit of juice or milk, but ideally, you know, you want to try to introduce those healthy habits at an early age. So ideally you want them to be drinking more so with water.
Certainly.
Good. Okay, I have a question. We're waiting to get Dr. Simone on. How often should you go to the dentist to have your teeth checked?
So definitely twice a year. Some people that might have what's called periodontal disease, that might have to get those deep cleanings and things like that. Occasionally, those types of people would have to go every 3 to 4 months. But to get your exams, you need to be going twice a year.
Okay, and that's for the exam and cleaning, or just the exam?
Yeah, exams, and you typically your cleanings, but if you have advanced issues, then those people that need deep cleanings will have to go more frequently. And every time you go to your dentist office, they really and truly should be doing an oral cancer screening on you anyway. So it's more than just getting x-rays and checking to see if you have cavities. But it should also entail, you know, like I stated, doing a head and neck exam, looking in your mouth, looking for things that do not look normal, so that if there is something that does not look right, that referral should occur sooner rather than later.
Okay, and then
And I can talk again, ladies.
Oh, there's
great. She's back.
Very good. Thank you.
Good.
Yeah, I was trying to
All right.
tell the host to put me back. I apologize, ladies. My apologies. Yeah, so we want to see to the milk question. We're seeing a lot more alternatives to a healthier lifestyle, and they're doing a lot of studies about like milk and alternatives like almond milk or soy milk. So I'm trying to get patients to not necessarily do as much of the cow milk as much, because it does have a lot of sugar in them. But then with the almond milks as well, you also have the issue of the ones that have a lot of sweeteners in them. So I'm a huge fan of water, you know, and taking vitamins, because I think that really is the best bet for kids' teeth, especially when we don't necessarily know if the nutritional value of milk is as strong as we thought it once was. So calcium, you know, in different ways. The other question was about the dentures. Could you repeat that again for me?
That was the question about should they consider doing an implant or dentures for a missing tooth in the back, or I guess a missing tooth, and they're 60 years old.
I think that the best thing is that I would love for you to get a chance to go see your dentist. Sometimes we think that implants are the best option, but depending upon how much bone you have or how the formation of your mouth is, that may not be the best. And so by getting an opportunity to see your doctor on a regular basis and having the proper people evaluate, like Dr. James, who's an oral surgeon, that general dentist is going to be that liaison between that to making that decision. So a lot of times people think like with dentistry, oh, we can answer the questions like, you know, verbally. It's a little harder to do that. Just like if I was to want a different valve, you know, I would go say, hey, you know, there's different reasons why you may need different things. So the best answer for that is just get a chance to go see your dentist. They're going to help you with coming up with that decision that may financially be a great option for you, but also that you can tolerate.
Okay. Well, I have another question. Can HPV be transmitted from person to person through kissing?
If you have an oral lesion in your mouth, especially, yes, absolutely.
Okay.
So what advice would you give people concerning?
Yeah, that was my question. What would be the advice
would you give them
Know your status.
Well, yeah, but
yes, but be very careful. You know, I wouldn't, you know, be very selective in, you know, of course, who you're kissing. You know, so I think that has a lot to do. I think a lot of people tend to be a little bit more freer these days, but you got to remember, you know, everyone is not healthy. Even though someone looks healthy, that might not be the case unless you truly know, you know, a little bit more about that patient's medical history and their sexual history as well. So those are always things to consider because that can be transferable.
Is there some type of testing that you're recommending that they have, or just having some information, okay, about that person, or having some time spent, okay, so that you know them a little bit better?
I think what you stated in the latter for sure. Unless someone is unless they're actually going in and getting a screening or, you know, getting a biopsy or something like that, you never really quite know.
Okay. All right. Thank you.
So just basically asking questions and getting to know them a little bit better.
Mm-hmm. Yeah, knowing their social history.
Yeah, I think a lot of times people miss out on going to the dentist because of the pain. They feel like it's painful. So can you address the cancer screening is not painful, that it's just a little thing that they put in your mouth to check to see if there's any form of cancer?
Yes, absolutely. So, you know, it's not any needles involved at all. So I think that's what a lot of people are very afraid of. I'm like, I'm just talking to you today. I'm just talking to you. I'm just gonna, you know, just kind of check some areas. I might, you know, we might probe some areas a little bit, but it literally will feel like this. This is what you're gonna feel. Be touching me. That's all you're gonna feel. But it should not be a painful procedure at all.
Right.
This can all be done by your regular dentist.
Mm-hmm.
Okay?
Yes.
Right. So
yes, correct. Absolutely.
General dentists are places. Yeah, they just need to make sure that they're going into the dentist. I have another question about kids. A lot of times people don't know when they should take their children into the dentist. And do they need to take them to a special dentist, or can they take them to the dentist that they see? How early should they take them in?
So as far as they should be seen when the first tooth comes. So a lot of times by age 6 months, a lot of infants especially will have a tooth that's coming from the bottom typically. So it depends on that provider. I don't know if Dr. Ellis sees kids or whatnot, but it depends on the provider that they're going to see. But there are pediatric dentists that are out there as well. But then there are a lot of people that have a family practice, so they will see, you know, patients of all ages.
So you can see your own dentist.
Yes. So I think it depends on, you know, who you feel most comfortable with. But that once the child has a tooth that's there, 6 months, is the sooner that you introduce them to that person, I think that will be the best for the patient, for the child. Because what happens, what we don't want is for them to have never seen anyone, and then all of a sudden, by the time that they see a dentist, whether it be a general dentist or a pediatric dentist, they have a lot of issues, and now they're afraid because now if they have to get something done, you know, it's going to be a little bit more traumatic because they have to get numb now. So now they have to get a shot. And so, and then, you know, what we don't want is for a patient to use the dentist as, you know, something negative. Oh, you don't be quiet, I'm gonna take you to the dentist. That's the worst thing that can happen. You know, so it should be, you know, the sooner that you can get your child in to see them and get evaluated and get them used to being in the dental chair, that introduction is definitely necessary because you want them to be able to learn how to be a good patient, basically. You know, so it's important.
I think Dr. Ellis does family dentistry, and I think having a family dentist, okay, that everybody goes to, everybody knows, we all go together, okay, for the dentist, for our checkup, we make it a family deal. then
Yeah.
it makes it a lot easier to get things done, and a lot
Right.
easier for kids as well as adults, okay, to get their checkups on a twice
Absolutely.
yearly basis. If we can just
Absolutely.
get that across, that everybody can do that, then that will make a tremendous difference. Yeah.
Mhm.
Okay, I have just two more questions. One question is, I have 2 wisdom teeth that I never had removed. I'm 61 years old and just developed a salty taste on the side of my mouth. Got an appointment on Monday, but could an implanted tooth cause that taste?
Say that one? I guess I kind of got confused. I heard wisdom
I know.
teeth and then something.
Yeah, 2 wisdom teeth that I've never had removed, 61 years old, and just developed a salty taste on one side of my mouth. I have an appointment for Monday, but could an impacted tooth cause that taste?
It depends, honestly. If you're going to see, your surgeon on Monday, they will get some X-rays on you. They're going to do an evaluation, and they will see if that is the cause. It could be the cause, but it could be other issues that are going on as well. So I think that it's best to get the X-rays and for the evaluation and see what the primary cause is. Just because you have a wisdom tooth doesn't necessarily mean that you have to get it extracted. It's different reasons why we take wisdom teeth out. Number 1 is pain. Number 2 is, it might have cavities that you can't fix, or infections, or it might have a cyst or a tumor or something like that is related to it, because it's maybe an impacted tooth, meaning that it's underneath the gums, or kind of halfway in the gums, halfway out, where you have this flap of gum tissue on top of it that constantly gets swollen or inflamed or infected or something like that. But if you're going Monday, you'll find your reason, hopefully.
Yeah, great.
Fantastic.
Okay, can parents develop HPV? Can HPV be transferred to parents by using the same utensils as their children?
Oh, I guess you're saying that the child has HPV, and
I think it must be
giving it to it, or can they give it vice versa?
Right.
I think
Probably
that's
vice versa.
probably vice versa.
Well, that it's kind of hard to say. So, I mean, and hopefully, if someone is diagnosed with, some type of illness or a disease such as that, you would hope that, they wouldn't be sharing any products or any utensils or anything like that.
Exactly.
So you just have to be very safe, especially, or, that can go for anything. You can have an active herpetic infection or something like that. So you just have to be very, very careful with those things. I personally would not, if I had a lesion or something that was of concern.
Right. Okay. Last question is, I haven't had my teeth cleaned in over a year due to the pandemic. Is it a safe time to go and get them cleaned now?
Yes, I think Dr. Ellis addressed that. Are you here? Are you there, Dr. Ellis?
Yeah, she wants to talk. I think she wants to talk.
Yeah. No, it's fine. It's fine. Dr. James has been doing a great job. Can you guys hear me pretty good?
No, it's kind of scary. Yeah. Yeah, it's very low.
Sorry. Portia, I guess you got it, because I'm sorry. I've been having trouble.
I'm not a dentist, and I just had mine going on.
Yeah, it's okay. I think a lot of people are implementing some really great precautions. A lot.
Yeah, I had my teeth done.
Yeah, a lot of people are implementing some great precautions.
Yeah.
Yes.
Things are being done at the dentist office, and I think we're all safe to go there. Just like they're opening up schools. Okay, we're talking about doing that. We're going to have to get back to some of the things that keep us healthy and keep us from developing other problems. But certainly they've outlined definite procedures and protocols for the dentist office, and I think Dr. Ellis went over all of those things that we expect when we're going to the dentist. So as long as your dentist is certainly adhering to those things, we should be safe, and certainly we should be able to go.
Yes.
Yeah.
Absolutely. And I felt safer going to the dentist than anywhere else, because they've always been very clean and very sterilize everything before you touch it, all of that.
Yes.
So I've actually I've actually had a root canal done during the pandemic. I've had my teeth cleaned during the pandemic, and I've never felt unsafe at all. Of course, they practice social distancing. You have to wear your mask when you come in, and then once you get in the chair, you take your mask off. But I think to me, the dentist's office is sterile. So yeah.
Right.
Yes, they do an excellent job.
Yeah.
Excellent
Well,
job.
I think that was all the questions, and it's time now for, I think, games or something.
It is time for games, but I wanted to get everybody to focus on Dr. B's shirt. Dr. B, can you just stand up for a second? And
I
want
can't
you
really
to see
stand up. I
how
could go right here.
She supports how B's girls and sassy ladies support everything that we do. My smile matters.
My smile matters. Yes.
Thank you so much.
Yes, you know, one of the things that people always say, and when they see me, is that my smile is amazing. Well, that's because I've always taken care of my teeth. I mean, it's so important to me. And even though I have veneers, I still go twice a year to get my teeth clean. I do my flossing. I use a floss machine. I train my girls, whenever you brushing your teeth, brush them at morning and night. Use your floss even use your floss when you finish eating, because if you take care of your mouth, then everything else is going to be fine.
Yes. I always joke to patients. I tell them, I say, you don't really want to see me. You have to see me. There's something, we're going to have to cut on something. So,
we're going to go see Dr. Ellis.
Yes. You don't have to see me.
Right. All right. So, Dr. Ma, last year we had some great pediatric dentists on as well. Yes, and so perhaps those of you who need information about a family dentistry, maybe we can post it on our website, the different dentists that we have. And then I saw a former member of our church who moved to Mississippi, Mississippi, Dr. Filson, Dr. Angela. She said to tell you hello, Dr. Portia, Dr. Angela Filson. I can't remember what her maiden name was before now. I've been Filson so long.
You're all over the place.
Hello. So we're ready now to go to play games. And so you want to stay around for the games, and we're going to have some raffles as well. And so Dr. Mott, you can go ahead and introduce the game.
So remember, whenever we do this, we always give information, but we always have fun. Okay. So we've gotten a lot of information, and now Miss Tiffany Hatchett is going to come on, and we're going to play a game. Oh, it's Dr. Coleman. Okay.
And she has on her shirt.
She has on her shirt. How about that? Yay. There's Miss Tiffany Hatchett. We're going to play a game, and we have a raffle. So you guys are going to get all kinds of prizes. So, Miss Tiffany Hatchett, you want to start us off with the game?
Absolutely. I'm excited too. We've had a great amount of information today. And so now we're going to take the opportunity to test and see if we all can recall what was shared with us here today. So if you would, I will ask the question, and then the team here will monitor the chat. The first person to put the correct answer into the chat for each question will win the prize. Okay? So first question, what are some of the COVID-19 patient precautions at dental offices? And there's multiple answers here. So what are some of the COVID-19 patient precautions at dental offices? Let's see if we could get a correct answer. And so please type your answers. I see Cassandra Barnes, mask. Very good. So a lot of correct answers are coming through here, but some of the examples were temperature checks, hand washings, peroxide, rinses, and of course, gloves, PPE. So great job to all of those that have answered correctly. Okay, second question. Why is it important to visit a dental office even in a pandemic? So why is it important to visit the dental office even in a pandemic? All right, let's see. Some answers are coming in. Remember, the first to answer the question correctly wins the prize. Very good. Kimmy Ruth, prevention. Absolutely. Ebony Mitchell also has a great answer. So some of the examples we received was, again, prevention to prevent tooth decay, gum disease, and tooth loss. So very good to those who've answered. Keep those coming. So here's a question, and this is a statistic I think Dr. Ellis gave us in her talk. How many people are affected by oral disease throughout the world? How many people are affected by oral diseases throughout the world? And so the correct answer is a number. She gave us a pretty large number in her talk. Let's see some correct answers. All right, close. So Kimmy Ruth on my screen got it first with 3.5 billion. Actually, 3.58 billion was the answer that she gave us. And so another question we wanted to ask here, the risk of a patient getting COVID-19 in the dental office, is that high? Is that a medium risk, or is that a low risk? So the risk of a patient actually catching COVID-19 in a dental office, is that a high risk, a low risk, or a medium risk? Let's see. We have the answers here. Very good. Very low risk, because we talked about all of the precautions that dental offices are using. And then, I mean, we had just such a great testimonial about our cancer survivor here, and she blessed us with so much great information. So, question, what are the risk factors for oral cancer? What are some of the risk factors for oral cancer? What are some of the ways we can catch or get or be diagnosed with oral cancer? All right, the answers are coming in. And there's several correct answers for this question. Smoking, Titane Roberts, very good. Smoking is absolutely one of them. Smoking, heavy drinking, HPV, right? We learned a lot about HPV today. So some of the answers given: tobacco use, alcohol, sun exposure. That was a new one for me. HPV, and just a weakened immune system makes us all kind of susceptible to oral cancer. Next question. Which ethnic group is the highest risk of death due to oral cancer? So which ethnic group has the highest risk of death due to oral cancer? Let's see. The answers are coming in. Yes, Lucretia Stewart. Unfortunately, African Americans lead the statistics for mortality in oral cancer. And so, next question. Our guest speaker, again, who was brilliant, what type of cancer was she diagnosed with? What was the rare cancer, the name of the rare cancer? And this isn't a spelling contest, so if you don't get the spelling right, that's good. Don't worry about it. But what type of cancer was our speaker diagnosed with? Let's see. Yes, Kimmy Root. Kimmy, you're fast. Adenoid cystic carcinoma is the type of rare cancer she was diagnosed with, and again is beating, which is a wonderful story there. And final question. Final question is adenoid cystic carcinoma common among African American women? Is it a common cancer for African American women? All right, here we go. Let's see the first one to pop up on my screen. Kimmy Ruth again. Kimmy, I'm going to start calling you like quick trigger Kimmy because you're always fast to answer the question. The answer is no. It is not common. It is a very, very rare disease. And again, great to hear that our cancer survivor is on the other side of it. And so thank you. You guys were clearly paying attention. Thank you for answering the questions. And we have taken note of our winners here, and we will be following up with you with your prizes for paying such great attention to the presentation here today. And so now I think I'm passing it over to Dr. Linda Brown Coleman, who is going to share the names of the raffle winners.
Yes, and I don't have the names yet, but be assured that I get each name and I get an email address for each person. I either reach out to you at that time, because many of our gifts have been gifts that need to be delivered or mailed. Some might be emailed when they're gift cards. But one gift in particular that is very, very popular is from Hope Farms. And we had some winners last month who were to receive the Hope Farms veggie package for 4 weeks. And I just need to let you know that that's been delayed because of the freeze. They are back up to speed, so we should be getting those out very soon. But if you remember, if you were on the program last month, you'll remember that Hope Farms is a 7-acre farm. It's located in Sunnyside, in the Sunnyside community, which is an historically designated food desert. And for the winners of that prize, you will receive the veggie package, and you'll receive it each week for 4 weeks. And they'll be providing you with that, Hope Farms will be, from their current harvest. We hope that you'll enjoy it as you journey to become more oral healthy. Also, some of the raffle gifts will include, and some of the winners from the game, those items will include an Instapot, a Fitbit, and electric toothbrushes. So those are the games. Once I get the names, I will communicate with you. If you have not received gifts from last month, don't worry. I've either emailed you or you have emailed me. And I'll be delivering some of those gifts personally to you.
Hi, thank you so much.
I think that maybe Wanda may have some wrap up.
Yes, I have the winners from the game. From Facebook, it's Cassandra Barnes, our first, and from the winners from YouTube are Rochelle Brown. Dr. B, do you have them as well?
No, I don't see them.
Okay.
I don't see the names.
And
I'm waiting.
From the second place from Facebook was Ebony Mitchell. And from YouTube, it was Pam M. The third place was from CA from the YouTube, and from Facebook, it's Kimmy Ruth. And fourth is Sharon Moore from YouTube. Fifth is Lucretia Stewart. And then we have Andrea T. Renee Roberts from Facebook, Andrea Sanders, Lucretia Stewart from Facebook, Andrea Sanders is number 6, Kimmy Ruth, number 7, number 8, we had Kimmy Ruth from Facebook and Kathy Williamson from YouTube. All of those will be sent to you, Dr. Linda Coleman Brown, and certainly we will get these out to them. Okay.
And those were the winners of the questions, not the raffle
those were
winners.
The winners from the questions. The raffle, I haven't been sent those, but we certainly will get those out as well. As
right.
as
and Destin's going to give us the raffle winners in just a moment.
Oh,
And
great.
so while she's pulling the raffle winner's name, let me just say to those of you who are watching, the gifts that are given away every month are absolutely amazing. You know, there are gifts that I would want to have, the Instapot, the electric toothbrush, all of those things. So when we ask you to register to go to Be Health to 71441, it's the way that we pull the names. So every month you need to go in and register, put your name in, go Be Health to 71441. Next month is all about diabetes, I think.
Yes,
And so
we have a flyer for that.
yes.
I just want to take a moment, Dr. B, just to thank Dr. Courtney Chance, who planned this program for us and introduced us to all of these wonderful speakers. She is from Oak Point Pediatric Dentistry, and she and her husband have a dental practice there here in the 3rd Ward area here in Houston. I just want to thank her for all of her efforts to bring all of these people forward so that we could get this information. Thank you, Dr. Chance.
Absolutely. And Dr. Mott, I'm going to ask if you could give us give Brianna the names of the dentists from last year as well as this year, and we'll post them on our website so that people can have an opportunity to go and make a selection on the dentist that they want to use. And I have 3 names for the raffle winners. Charlotta Jimerson is one, Wanda Ray is one, and Grace Evans is another one. So those are the 3 names for the 3 raffle winners. So Dr. Coleman will get your gifts to you, and we'll get those names to her, and we'll have them sent to you as well. Right before we go, I want to show everyone a clip of a very special seminar we're having on this Friday evening on social media, because it's about prosperity and having money. So if you want to have good, healthy teeth, you need money to spend on them. So I want you to show this clip real quick if Destin is ready. If you'll roll the clip, and then we'll come back with some closing comments.
Thank you, sir.
Well, it's masterclass time, and I could hardly wait to host this masterclass of 2021, how to dream big and how to think big. Now, what you think and how you think controls your life. Learning the skills, thinking more effectively, more creatively, more innovatively is what sets the successful apart from the unsuccessful. Now, I'm believing that what happened to me years ago when God brought this revelation to me will happen to you when you hear this teaching. Now, like many others, I was thinking too small, and God showed me how to stretch my thinking and achieve success through faith. Now, I live large today. Yes, I do. Praise God. Because I began thinking large years ago. Now, it's the Seeing Beyond the Moment Masterclass Seminar on March the 26th at 7 p.m. Central Time. Now, the registration is free. That's right. It's absolutely free, but it's essential. Listen, I need you to text. There it is on the screen. MCSBM to 71441 to secure your spot in the class and learn about, the class notes. Now, it will be a time of personal mentoring with me that will be like none other. Let me help you like I've helped so many others. Let me teach you the scriptural protocols for developing a problem-solving mentality, a prosperity mentality, a professional mentality, and a more productive mentality. There it is on the screen. I want you to do it. Text now. The 71441 text. There it is. MCSBM. All right, secure your spot in the March 26th Masterclass at 7 p.m. Central Time. Your success tomorrow depends on what you do today.
Yes.
Really?
So your success tomorrow depends on what you do today. So I really want to encourage you to be a part of the masterclass. It's absolutely free, absolutely free. So the comments are great information on oral health today and
Great.
taking care of your choppers, they said. And so it's been really, really great. And Dr. Mine, I want to personally just say thank you to you and to the Sassy Ladies for investing your time every month with this. We've been doing this since 2019.
Yes.
So we did all of 2019, and then of course 2020, the wonderful pandemic hit, and we actually had our last in-person Be Health meeting in March.
Yes,
the
we did.
March of
Yes, we did.
2020. And then right after that, everything shut down. And so we became creative and thought a way of to do it. And so we started doing it by virtual, which I believe the virtual is a whole lot better. And so I want to personally say thank you for investing your time, and of course, all the professionals for investing their time into the ladies in our community and helping us to get the word out about our health. It's so vitally important. And so do you want to share a little bit about next month, about what's going to happen, and then they'll put the flyer up as well?
I would love to. Certainly next month, we're going to talk about something that it actually involves so many people in our community, and that's diabetes. It's called No More Sugar. And certainly every one of us has somebody in their family that has diabetes. So we're going to have facts on diabetes prevention. We're going to have nutritional facts, and we're going to have information from different endocrinologists, professionals, as well as people that have actually had diabetes and things that they've had to go through for it. So please stay tuned and go in and register immediately. This is going to be very, very informative.
All right. Well, thanks again, everybody, for joining us. And of course, I really want to encourage you to definitely use the dentist offices that we will make available on our website.
Yes,
of course, make sure you take care of your oral health. Is so vitally important. And then I want to just say thanks again to Miss Candice Easley. And of course, anytime you go by her boutique or anytime you see her, she's going to share her testimony, which is amazing. And so I want to thank her for her time today as well. It's been amazing. It's been a great Be Health initiative today. And so we're so thankful for it. And again, we'll see you next month. And remember to text Be Health to 71441. That's Be Health to 71441. And we'll see you on next month, April 3rd.
All right. Thank you, Dr. B.
Thank you.
Have a great weekend.